Yes.
Where in Washington did she come from?
Newport. I'm going to say south of Spokane, I believe.
You know, with her, you know, with a horse or equine, I should say, of her age, you're going to have arthritis. It's kind of like an 80-year-old person, even if they, you know, sat around did nothing their whole life, they're going to have some arthritis. It's kind of an old age change. And the question is, arthritis causes more Mind your manners. So it looks like she's got some degenerative, you know, joint disease, more specifically in this joint. And that's something just to be on the, you know, the joint supplements and stuff like that that will help her out. You know, as needed, things like that. Let me look at her teeth. She's really that old. Yep. Every bit of it. Now, when you start getting real old, you start to lose your accuracy as far as judging their age by their teeth. I would have actually called her like 26 based on her teeth instead of 36, because she still has what we call a Galvin's groove halfway down on her third incisor. She came at the right time, because if she would have came here in the summertime, they would have eaten her alive, the flies. Now with these things, we'll just kind of keep an eye on them. If they persist, we'll go ahead and treat them again. And you know, if it persists despite treatment, you know, we may want to take a biopsy or something of that nature. And the reason for that is because whether we're treating a parasite infection, like, you know, lice, something like that, or we're treating allergies, the treatments are totally different. You know, the treatment for allergies, if you treat her, it will make that infection, if it were a parasite infection, much, much worse. So you want to delineate which it is before treatment. So we'll kind of just see what she does.
How often should we worm her then?
Do you know her history? Was she dewormed other than when you dewormed her recently?
She was wormed just prior to her coming here a week ago.
Okay. Do you know what with?
Zamectrin.
Zamectrin? Okay. And you dewormed with a ivermectin too?
Right.
What I would do in another probably 3 or 4 weeks, go ahead and deworm her with Zamectrin Gold or Equimax.
Okay.
And then just basically just like any other horse.
All right.
You know, once, twice, 3 times a year at the most.
Okay. And can we go ahead and vaccinate her as well?
I'd actually go ahead and wait for her.
Okay.
Because she just got here 2 days ago. She might be a little bit stressed. And when we're giving a vaccine, and a horse is stressed, basically that stress, they secrete an endogenous steroid, or a steroid that the body makes, this natural steroid, which suppresses the immune system. So the immune system is going to respond to the vaccine. You won't get any protective antibodies, or you will get less protective antibodies than you normally would. So usually I recommend going ahead and keeping an eye on her for a couple days, and maybe in about a week or 2 weeks, go ahead and vaccinate her. The other reason is she may have an infection, an upper respiratory infection. She just hasn't showed us any clinical signs yet. You know, a lot of the diseases. There's what we call an incubation period where they can actually be infected, not show any clinical signs, and all of a sudden she starts clinical signs in a couple of days. Well, that's another reason why you don't want to give a vaccine.
Okay. Thank you.